Hello, welcome to my presentation. I am Smitha from Sultanate of Oman, presenting the poster titled An in silico approach to lead compound identification for Alzheimer's disease accepted in the communities of special interest named translational medicine. Here are my co-researchers, and they are based in universities and organizations in Oman and India. Let me give a background of our research. Alzheimer's disease is a progressive neurological disorder that affects the function of the human brain. As per WHO, there are around 55 million people having dementia across the globe and approximately 10 million new cases every year. Unfortunately, there is no drug available to cure Alzheimer's disease, but to slow down the progression of neurodegeneration. Moreover, the drugs in various phases of clinical trials for Alzheimer's disease are much lesser when compared to various other disease conditions. In the omics era, computational methods have been a boon in the drug discovery field, with bioinformatics and cheminformatics databases and tools complementing the successful discovery of promising lead compounds. Our current research aims at applying an in silico approach on multi-therapeutic agents against multi-therapeutic targets through docking studies to explore potential lead compounds for Alzheimer's disease clinical trials. Among these several hypotheses for Alzheimer's disease, 4 potential targets for anti-Alzheimer's drug discovery are considered in the present study. The therapeutic targets considered in this study are the human BUCHE, acetylcholinesterase, NMDA receptor antagonist, and beta amyloid peptide. With respect to the drug molecules, the FDA-approved drugs used for Alzheimer's disease, namely donepezil, rivastigmine, galantamine, and tacrine, were used as the control. Here is the in silico approach followed in identifying the lead compounds. Initially, the FDA-approved drugs were used to retrieve similar structures using Swiss similarity tool. The tool enabled the search against a database of 4,788 FDA-approved experimental drugs. Among the list obtained, the top 5 ligands corresponding to every drug molecule were retrieved based on the Tanimoto score. Finally, 20 test ligands or the hit compounds were used for further investigations. The physicochemical properties and ADMET properties were determined using the Swiss ADME, ADMET SAR 2.0 and PKCSM online web servers. The ligands and targets suitable for docking were performed using AutoDock tools. Further, AutoGrid was used to create the grid box for the target proteins in their respective active site region. The parameters such as addition of hydrogen, Kalman charges, and solvation of the protein structures were applied using AutoDock tools. Finally, AutoDock Vina was employed for docking the ligand structures into the binding pocket of the proteins to obtain the best ligands as lead molecules based on the highest binding affinity values of the docked complexes. Overall, from the docking studies, it was observed that the compounds as shown here showed highest binding affinity with the target proteins and have the least side effects and better efficacy. Based on the pharmacokinetic properties, toxicity-based studies, and binding affinity, it is observed that these ligands are best suitable for further investigation in the drug discovery pipeline. This study was funded by the Research Council of Oman under the Open Research Grant Program. Thank you.